All right, welcome to Chapter 1 EMT course. We're going to be going over the Emergency Care Chapter 1 today, talking about some research, special issues, and components of the EMS system. So, it all started way back when, Napoleonic Wars. We had some basic field triage starting, Civil War, World War I. We started actually having ambulances moving people off of the battlefield. Korean Vietnam, we actually had MASH units started, helicopter transport, flying on the side of a helicopter, just like they show it in the show MASH if you've ever seen it. First non-military ambulance service began in the early 1900s in the U.S., operated by hospitals mostly, some fire departments. A lot of funeral homes started off running ambulance services. So if you died, they just got an extra business, right? There's no requirements. There was no real training. Nothing like what you're going through today. 1966, we had the Department of Transportation charged with developing EMS standards, set up the first standards for EMS, and kind of was a jumping off point for where we are today. In 1970, the National Registry of EMTs, also known as NREMT, who you'll be licensed through, was founded and began operation. 1973, we had the National Emergency Medical Service Systems Act passed by Congress. Lots of dates here. Important to note, DOT was and is the accrediting agency for us. So what did ambulances look like? Look something like this, a lot different than they look like today. When you do your clinicals, you'll see some different ambulances out there from us and other agencies. But they're pretty much state-of-the-art these days. So NHTSA, standards for EMS systems that regulate the policies. Each state establishes their own laws, policies, and regulations. But they try to have some centralized coordination of emergency treatment and transport resources. They assure EMS personnel are trained and certified to the minimum standards, that we're providing safe, reliable transportation. A large portion of what we do is transportation. So we need to be aware that that is what we do, getting people safely. When we train our EMTs in-house when they get hired, the number one focus is getting to and from the scene safely. We transport to the closest facility. Right now, emergency medical care is based on transport. So in the future, we may be able to do more on-scene treatment, but right now all the billing models are focused on the transport. Communications, Universal 911 has come around and has been around for some years now. Pretty much everybody in our area has that. Some local, I think, agencies out in the boonies still use a full 9-digit number or whatever, but most of us are on 911. So, NHTSA says standards for public information and education. We do hands-only CPR in the community, trying to teach people what's going on. And that a medical director is accountable for EMS personnel within the system. So you all, as students, actually fall under our medical director. Dr. Gustafson is our medical director, and all of our protocols are signed off by our medical director, and so are you as students. Supposed to develop trauma, triage, transport, and treatment protocols, and establish programs for QI or QA, quality improvement, quality assurance. So there's components of the EMS system. Each EMS system has emergency medical dispatchers, or should have some sort of dispatchers. They answer the 911 call. Then there's EMS responders. We then take them to the emergency department, which has doctors and nurses, or a specialty center, trauma center, or someplace like that. So specialty centers include trauma centers, burn centers, pediatric centers, and cardiac centers, stroke centers, all the above. So depending on what kind of patient you bring in, this looks like a trauma patient. They're backboarded, and they're doing a thorough exam of that backboarded patient before they move on with the treatment. So some things to think about. This is a pretty short lecture, but it kind of just introduces you into what we're talking about. What services are available in your local community, not necessarily here where you go to school, but your local community. How important is it that EMS personnel have the capabilities of community medical facilities? So in Warrensburg, we've got about an hour-long transport to a level 1 trauma center. We've got to be able to handle quite a bit on our own. We have a local level 3 trauma center, but They can only handle some basic trauma, and anything that's pretty advanced needs to go to a level 1 trauma center, like Research Medical Center or someplace like that. So if we transport somebody to the wrong place, that could cause some serious problems. It could delay their care. It could cause them really anything up to and including death. You know, if the local hospital cannot handle the issue and there's a significant delay, that could cause the patient significant issues. It's kind of a chart of how things happen, and you guys should know this pretty well. An incident occurs, somebody calls 911. We have EMD dispatchers, emergency trained medical dispatchers who EMD the call. They run through a set of protocol questions to figure out what kind of response they need. First responders are towed along with an ambulance. A lot of times first responders will get there first depending on the situation. So fire or police might get there first, then EMTs. We transport to an ER, and then they get continuing care throughout the hospital system. Almost always a question on your test about Enhanced 911 provides caller number and location for landline phones. Pretty much every community nowadays has 911 that we talked about. EMD, they can provide instructions to callers on how to provide emergency care until we arrive. The first responder is always the patient. So they can help themselves out before we ever arrive. Our system requires EMD, but yours may not, just depending on where you're at. So you got to be able to make good decisions in EMS. Every decision you make is a critical decision. On the way to a call, getting to a call, how to proceed through a stoplight, all of those are decisions that fall on you. And that's all part of being a good EMT. Sometimes these are time-critical decisions, all right? So you have to be able to make good decisions in a very fast manner, thinking on your feet. And if you remember, I think I already told you this, but when you get those tones, staying calm, taking a breath, trying to relax a little bit. I wish somebody would have told me to take a breath every time the tones dropped when I was a brand new EMT. It would have helped me out greatly. Making decisions about which hospital to go to, the closest hospital or the best hospital. And is the patient stable enough, or should they be transported to the closest facility? Will each and every treatment make the patient better or worse? Our number one goal in EMS is to do no harm. So we have to make that decision. Here's some levels of responder training. Emergency medical responder, previously called first responder. Normally firefighters have this at their level if they're not EMTs. EMTs, emergency technician or medical technician, previously called EMT basic. These folks can administer basic medications, which we're going to go over. This is what you're training to be. It's required in a lot of states to be on an ambulance. Cannot start IVs, cannot give a lot of medications, can insert basic airways, that kind of thing. We're going to go over all that. Advanced EMT, previously called EMT intermediate. These folks could start IVs and give some basic meds via IV. And then paramedic, previously called EMT paramedic, can do a lot of stuff. They can do a lot of stuff. And some people are actually surprised at how much they can do compared to even RNs. So roles and responsibility of you, the EMT. First of all is your own safety. Our safety always comes first. That may sound backwards because we're in the business of helping people, but if we get hurt, we can't help others. So our safety typically comes first. The safety of the crew, the patient, and the bystanders. Doing a good, thorough patient assessment, trying to figure out all the issues. Having good patient care, trying to take care of the patient, lifting and moving the patient in a safe manner, getting the patient to the right destination, to the right hospital, providing a good transfer to the receiving hospital, and then always being a patient advocate. And what that means is you're trying to take care of the patient's needs, whatever's best for the patient, even if it doesn't seem to be happening. So you have to be willing to step up and say what you need to say in order to help that patient out, even if the hospital doesn't seem like that's what they're trying to do. Or if they're going down the wrong path, you may have to redirect them and say, look, this patient really does need these resources, and I know you guys are busy today, I know you're full, or whatever the case is, and try to really be an advocate for that patient to try to help them get the care they need. So, some traits of a good EMT: ability to lift and carry equipment up to 125 pounds. Good eyesight, it's always a good thing. Awareness of any problems with color vision. So you can be colorblind or color deficient. If you know me well, I'm color deficient. I don't have good color vision. I have some red-green when they're right next to each other. They can blur, but I can differentiate them if they're apart. Knowing that, being aware of that, knowing your strengths and weaknesses with that is important. Good communication skills, both written and oral, will be good. If you're pleasant, sincere, cooperative, and resourceful, it's all good. Because you have to be nice to these people. Once again, we're training you to take care of Mr. and Mrs. Smith, the citizen, and if you treat them poorly, you're not going to be a good EMT. They're not going to have a high view of you or your company, your agency. So first thing is always a professional appearance. We try to always have a good appearance on because people judge you as they see you walking out. Whether or not they're going to be able to trust you is based upon the way you present yourself from moment one. Some other good traits: being a self-starter, being emotionally stable, knowing how to handle stress. So being resilient, knowing how to handle challenges as they come up and what to do is important. So if you know stress can affect you pretty severely, you probably ought to have a good idea on how you're going to take that on and how you're going to handle it. Being neat and clean, well-groomed, and of good moral character and respect, all very important items. Being in control of your personal habits, knowing what weaknesses you have and what strengths you have, being able to take care of them, very important. Knowing how to be controlled in conversation, how to communicate properly, how to listen to others, and be non-judgmental and fair. All important aspects of being a good EMT. Keeping up to date on your knowledge and skills, definitely a good thing. Taking refresher courses, keeping up to date on education, going to conferences, always learning, trying to grow and learn to be a better EMT, very important stuff. So how do you think you can stay fresh? You can take EMT refreshers. You can go to advanced courses, always trying to learn things. Depending on where you're going to be at, maybe you're going to be on an ambulance service, maybe you're going to be on a fire department, some rural team, you're going to have to learn different things. Maybe you're just going to be a volunteer. All of those are going to require a different skill set that you're going to have to do more of. If you're working in a very rural environment, you have to be good at a different skill set than if you're working in the city, okay? It's going to be a very different thing. When you have to take care of people for a long time, you have to be very sharp on your skills. So NREMT, it's the registration for EMRs, EMTs, advanced EMTs, paramedics who successfully complete the National Registry exams. May help in reciprocity. If you're going to ever move out of Missouri, having NREMT is a good thing. Can be beneficial for employment. Once you have it, it's a lot easier to keep than to get it again. So I suggest once you get NREMT, keep it up to date on your refresher. There's always quality improvement pretty much with every agency. Continuous self-review, how you can do better. So you go on a call, you realize something wasn't perfect. How can I do better next time? Hey man, I really should have given that aspirin more quickly or applied oxygen right off the bat instead of waiting. He really got worse without that oxygen on. Those kind of things. You can do that to yourself. You can talk it out. And then once again, the agency is normally going to do it again. Medical director, everything's under medical director. They have ultimate responsibility. So these are some test questions here. Who assumes ultimate responsibility? Medical director oversees training, develops treatment protocols, issues offline medical direction, and provides some online medical direction. Definitely some test questions in there, so pay attention to that. We have an evolving role as EMTs in public health, trying to go out and do some injury prevention. They have a program called Community Paramedicine where we're actually going out in the community trying to prevent injuries and illness and readmissions. Public vaccination, watching out for disease surveillance or anything popping up across the community, we can report that. Going out and helping folks that are known frequent users of our system to try to prevent them from having to go to the hospital again. And then we are really moving emergency medical services in a trend of research. We're looking at what works best instead of just what has been done. So changing things, like you'll see, we don't board patients any longer at this agency. It doesn't mean that you're still going to obviously learn that skill because you might do it in another agency. And National Registry says you have to know it. However, we're looking at research-based items, and I would assume National Registry is looking at that as well, on how much longer we'll even be teaching that topic as it falls out of favor with research. So we form a hypothesis, we review literature, we evaluate the evidence, we adopt the practice. If you watch a cardiac arrest while you're doing clinicals here at this agency, you're going to notice that there's some crazy stuff happening. We're using a plunger on the chest, we're doing all kinds of things. There's this little device on their mouth, and all of that has been used, research shown that that worked. That was a a favorable statistic in several research studies, and we have seen and are conducting research on it as well to see how well it's working in our system. And not all research is created equal. If you try to work the numbers, you can make research show about anything. But if you rely on the scientific method, you use comprehensive and comparative studies, obtain an objective opinion, you look at it from a third party's view, you can find out some good information. So there's different methods to reduce some bias. Some of these are test questions as well. Prospective versus retrospective studies. So retrospective means you look at data that's already happened. Prospective means you're doing research ahead of time and you're doing a controlled and randomized study. Randomized means you're getting folks that have no bias. They don't know who's getting the placebo, who's getting who's in the control group and who's in the study group. And then are the groups similar? Are they representative the same type of folks? That's your study group similarity. There's different types of medical research. You can do case studies or case reports, cohort or control studies, case control studies, randomized control trials, a systematic review, meta-analysis. A lot of what happens in emergency care is retrospective. They're looking at past cases and seeing what happened to see if they're effective. Not the highest validity type of study. However, it does give them some ability. It's hard to withhold something that we think is good from people, right? So if we have some research saying X, Y, Z is a good thing, it would be pretty bad to withhold that. So things end up being retrospective as they try those things out. So we got some questions to ask when evaluating a study. Does it assist in identifying bias or flaws in the methodology? Does it assist in understanding the study and providing needed information? What is the title of the study that we're doing? Who are the principal investigators? What is the research question? What are the study's inclusion criteria? What are the study's exclusion criteria? All this is needed before you start a study. Once again, I know this stuff doesn't feel like it's EMT material. However, you guys have to know this stuff. A lot of strange things are on National Registry that you think shouldn't be there, but are because they're part of the overall curriculum. Excuse me. So what EMS data is needed? Do we have to have consent? Is treatment going to be randomized? Are we going to withhold the treatment? All these things have to be identified. Has this been approved? I can't, as a random EMT, just start my own study. It has to be approved. We have to go through some steps, right? Some special issues in EMS we're going to talk about throughout the course. There may be administrative matters, course description, class times. We talked about all that pretty much. ADA, we have to give certain rights. If you have issues, we have to allow you to have some extra time on things. All that is going to be happening in our course. We've already talked about that a little bit. So anytime you see the review on these chapters, these are good things to pay attention to. They could be on your test. They're normally things we hit 1 or 2 or 3 times, or multiple times rather, are repeated for a reason, right? So pay attention to those things as they're probably on your test. You have all this information available to you through Brady. I'm just rehashing it to try and help you guys learn. Some people learn in different formats. So hopefully with a video lecture you will have some benefits that you don't have by just flipping through PowerPoints. I know I don't learn well just visually. I have to have hands-on or see and hear or learn things differently. Hopefully this will help you learn. Once again, this is chapter 1. It's very basic. We're going to get into a lot more in-depth stuff in future chapters. I do thank you for paying attention, and we will try to get a lot more of these out there.